I now give the floor to the representative of Sri Lanka. You have the floor.
Thank you, Chair. Sri Lanka reaffirms its commitment to the program of action of ICPD and its principles, particularly in ensuring UHC. As our Prime Minister noted in the keynote address in this morning, we believe that the right to health is a fundamental and a prerequisite for development. Sri Lanka remains committed to ensuring that all individuals have access to high quality, equitable and affordable healthcare services. Our free universal healthcare policy has enabled significant reductions in maternal and infant mortality, increased life expectancy, and improved maternal health outcomes. Over the decades, Sri Lanka has made remarkable strides in health and development. Maternal mortality is at 25 per 100,000 live births, and 99% of births are attended by skilled professionals with life expectancy at 77 years. It is worthwhile here to note that child immunization rate did not dip following COVID-19 pandemic or the economic crisis, which is testimony to the resilience of Sri Lanka's health system. Chair, Sri Lanka is undergoing a demographic transition with declining fertility and an aging population estimated to peak its population by 2050. In this context, we recognize that the burden of NCDs and age-related conditions will increase and can lead to an increase in disabilities. Our per capita health expenditure is expected to rise and in the coming years. While fertility is declining, the adolescent fertility rate has been stagnant over the years. The HIV rate among youth is also of concern. This has significant implications for adolescent health care and well-being. Chair, to address these challenges, Sri Lanka is actively redesigning the health system to build a resilient and inclusive healthcare model that prioritizes access and equity. For the 2025 budget, Sri Lanka allocated a significant increase to the health sector. In line with the policy, A Thriving Nation, A Beautiful Life, Sri Lanka's new government has begun reorganizing the primary healthcare system. The integration of essential maternal and child health care services, introduction of reproductive health for adolescents, youth-friendly services to improve their physical and mental health are some of the high priorities. To ensure health and well-being of young people, we are investing to improve comprehensive sexual education in schools and youth-friendly health services as part of our national policy framework so that young people receive age-appropriate information and services to make informed choices. We recognize the growing demand for elderly care and the need for greater investments in promoting health lifestyles and preventive health strategies in tackling the growth out-of-pocket expenses. We are also investing in improving access to assistive technologies for persons with disabilities. We are integrating these priorities in our National Health Policy Strategic Master Plan 2026-2035. Recognizing the importance of reliable, timely and disaggregated population data, Sri Lanka is investing in a country strategy for a development of statistics to strengthen our ability to formulate evidence-based health policies and enhance service delivery. Chair, advancing gender equity and empowerment is a key priority for our government. We are committed to implementing our national policy on gender equity and women empowerment through the formulation of a National Action Plan. We have enacted the Women's Empowerment Act and are taking steps to establish an independent National Women's Commission.
I thank the distinguished representative of Sri Lanka for his intervention.